Good afternoon, ladies and gentlemen. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to Ms. Jennifer Verma at CFHI. Please go ahead, Ms. Verma.
Thanks so much, Val, and thank you everybody for joining us. We're really pleased today to be able to provide an informational webinar, an orientation to the Evidence-Informed Healthcare Renewal Portal, or the EIHR Portal for short. Thank you for joining us, and if you haven't already, although you're a quite active group, please do feel free to introduce yourselves in the chat as I introduce today's speakers. You can tell us your name, where you're from, and also if you have any questions already about the portal. I can see already from who's signed in that we've got participants from as far as Yukon and British Columbia and all the way over to New Brunswick. So thank you so much for joining us for this truly pan-Canadian call. Our first speaker today is Dr. Robin Tamlin. She's the Scientific Director of the Institute of Health Services and Policy Research at the Canadian Institutes of Health Research. She's also a professor in the Department of Epidemiology, Biostatistics, and Occupational Health at McGill University, and she's in Montreal today. Dr. John Lavis is Director of the McMaster Health Forum, Associate Director of the Center for Health Economics and Policy Analysis, Professor in the Department of Clinical Epidemiology and Biostatistics, and Associate Member of the Department of Political Science at McMaster University, and he's calling us from Hamilton today. I'm pleased to host today's call. I'm Jen Verma, Senior Director for Collaboration for Innovation and Improvement at CFHI here in Ottawa, and I'm joined by our producer, Kelly Ripley, as well as our co-producer, Sheena Powell. And we also have our Senior Director for Evaluation and Performance Improvement, who's also very interested in an orientation to the EIHR portal, Kay Phillips. Our objectives for today's call, we want to truly orient you to the rich information source that is the EIHR portal. We're going to address all the fundamentals. What is it? How do you access and search it? How can you sign up to receive monthly updates? And John's actually going to give us a live demo running searches in 5 areas, and I'm sure they're highly relevant. They're areas that you're probably working on or concerned about, developing policy around. So he's specifically going to focus on end-of-life care, leadership, primary care renewal, timely access to care, and also political party platforms. So a nice array of information that gets at health services management and delivery. John's also going to walk us through a quick 4-question poll a little later in the call. We'll give you some instructions on how to address that poll when we get there, but I can see you're an active group and you're going to have no problem participating in that, so thanks very much. First, I'm going to hand the call over to Robin, and she's going to give us some background as to how this EIHR portal came to fruition. Robin.
So thank you very much, Jen, and to CHFI and John for partnering with us on this policy round and on this initiative. So I just wanted to give you a little bit of a heads up on how did this thing get started and why. So in 2010, CIHR launched one of its 8 roadmap signature initiatives, which focused on mobilizing rapid and robust research to respond to policymakers' needs on the important topic of healthcare renewal. And this was in preparation for the new health accord. The Evidence-Informed Health Renewal focused on 3 areas: financing and funding, health system sustainability, and governance and accountability for Canada's healthcare system and how that should be renewed in the future. This signature initiative actually was designed to fund policy-relevant research that would help governments make evidence-informed decisions in the area of healthcare renewal for Canada, and a number of different funding opportunities, including knowledge syntheses and policy analyses, were launched. As part and parcel of this initiative, CIHR convened organizations who are working in the area of healthcare renewal, NGOs, FPT, Ministries of Health, professional associations, and other organizations, to a meeting which we called the EIHR Roundtable, which was aimed at sharing current activities and exploring opportunities for synergies. We saw that a lot of people were working in this space, and we thought there needed to be an opportunity to coordinate these activities. And out of these discussions, in fact, the idea of a single access point for healthcare renewal related information was born. We called this the EIHR Portal, and we developed this in conjunction with our partners and with John Labus at McMaster University. So you can see here who the contributing partners were to the inaugural launch of this portal. 18 organizations from the Roundtable both financed and contribute documents to the portal. We continue to work with these partners and add new partners who want to have their work made more accessible to Canada, and I think you'll see with John's sort of presentation to the international community on these important areas for policymakers. Our vision for the EIHR portal was that it would be the premier site for linking policymakers and other stakeholders with information on healthcare system renewal and transformation, and it would become a reliable go-to tool for stakeholders to access evidence. With the support of these many organizations and really the stellar work of John Labus and his team at McMaster University, we set up the portal. I'm pleased to say that the vision has become a reality and this portal is now up and running and available to stakeholders to use. We see this as having enormous potential to support decision making. It also has a mechanism for linkage and exchange across jurisdictions related to health system innovations. One thing that has come out of our discussions is a need for people to have more training, have more information about the EIHR portal, and that's really the reason for these policy rounds, is to provide you with an opportunity of learning more about this. So I'm going to turn this over now to John. So thank you very much, John, for your incredible collaboration in this effort.
Thanks very much, Robin. And thanks very much, Jen, for the introduction as well. So this is an opportunity for me to go through a few slides to give you a bit of a closer look at the EIHR portal. And then, as Jen indicated, what I'm going to do is give you some live demonstrations and show you how to use the portal to search for some topics that are certainly front and center in dialogues across Canada right now. I'm just going to jump to the next slide and just briefly describe what the portal is. So this is Canada's most comprehensive free access point for policy-relevant documents that can support policymakers, stakeholders, and researchers interested in. And there's two ways that you could frame it. Either how can we strengthen or reform health systems, and there's certainly many folks across the country that have that as a core part of their job or a core part of their focus. Other folks come at this from a different angle. They're much more focused on the programs, services, and drugs that need to get to the people who very much need them. And how they get to those is through well-functioning health systems that have the right combinations of teams, the right financial arrangements, the right governance structures in place to get those programs, services, and drugs to the folks who need them. And the portal covers that domain. So we think of it as strengthening or reforming health systems. Other folks think about it as how do we get the right mix of programs, services, and drugs to folks who need them. I'm just going to jump to the next slide. So the portal is integrated into a bigger database, which we call Health Systems Evidence. And the nice thing about that is the synergy between the two, because the EIHR portal has all the policy-relevant documents that are produced by governments and other stakeholders that can inform decision-making in our system. But Health Systems Evidence gives you the best research evidence from across the globe, and having it all in one place makes it very easy to jump back and forth. So BC might have a particular report on primary care renewal, and you can then go to see, well, what are the systematic reviews of effects telling us about particular ways of designing primary care practices to optimize patient outcomes. So health systems evidence is a single point of access to the ever-growing body of evidence related both directly and indirectly to healthcare renewal. So in Health Systems Evidence, the bigger database within which the EIHR portal is nested, we have all the evidence briefs that are produced by groups around the world that try to focus on a health systems challenge. And evidence briefs here are something very specific. They're a document that is context-specific, so it could be specific to Ontario, or it could be specific to Canada, or it could be specific to another country. And it works through a health system challenge and the causes of any problems related to that challenge, options for addressing it, and implementation considerations. So a single brief might draw on 10, 20, 46 systematic reviews, many local studies, as well as local data. Health systems evidence also contains overviews of reviews. So if you want to know where is all the synthesized evidence about how to improve human resources performance within the system, you could go to an overview of systematic reviews and find all of the policy levers where evidence has been produced and synthesized in a systematic review on that topic. It also includes every systematic review in the world that has addressed health system questions. So these can be both systematic reviews of effects, so all of the Cochrane systematic reviews of effects that have to do with health systems are included in health systems evidence, as are reviews produced by any other group in the world. And it's not just systematic reviews of effects, it's also systematic reviews addressing other questions. So if you're wondering, how have nurses responded to the introduction of quality improvement initiatives in countries around the world where this has been studied, that type of systematic review, if it exists, would be sitting in health systems evidence. Health systems evidence also contains economic evaluation. So some of you might know the economic evaluation database run by York University in the United Kingdom. Every economic evaluation in the world pulled into that database and independently rated by 2 health economists and a structured summary presented. Every month, our team reviews those economic evaluations in the database and pulls out the economic evaluations that are specific to strengthening health systems and getting cost-effective programs, services, and drugs to people. Health systems evidence also includes health reform descriptions. So for many years there was an initiative called the Health Policy Monitor, based in Germany, that had a large network of high-income countries where they had country correspondents who would periodically report major health reform initiatives in their country and what was learned from those reform initiatives. We now, thanks to the leadership of a team led by Michel Grignon, we now have the Health Reform Observer, something that does this at the level of Canada. So if there's a reform like the introduction of lean thinking within the Saskatchewan health system, someone, in this case Greg Marshallden, writes a description of that reform and what has been learned from that reform process. So those are also linked to from within health systems evidence. And finally, within health systems evidence, we have health system descriptions, because we're often very interested in learning from other countries. It could be the United Kingdom has a particularly innovative approach to avoiding hospital admissions using home health care, and you want to understand how the home health care sector works within the United Kingdom, say specifically England. You could go to health systems evidence and pull up a very rich, hundreds of pages long description of the English National Health Service. So all of that is sitting in health systems evidence. Every time you search on the site, if you're searching in the EIHR portal, you're simultaneously searching all of these other databases. We also, in addition to the EIHR portal, have 2 other sub-portals contained within health systems evidence. One is still at the beta stage, and it's called the Intergovernmental Organizations Health System Documents Portal. So we're getting fairly close to having a complete inventory of every document related to health system or health system strengthening or healthcare renewal from the World Health Organization and its regional offices, and soon we'll have the equivalent for the World Bank. We also, for those who have a particular interest in Ontario, have a sub-portal specifically focused on that province. So all of this information sitting in one large database, health systems evidence. So I'll now go to the next slide and talk specifically about the types of documents that are included in the Evidence-Informed Healthcare Renewal portal that sits within health systems evidence. So this includes jurisdictional reviews, something that civil servants do on a regular basis. They're sitting in a province like Manitoba saying, gosh, we heard Nova Scotia was doing some neat stuff, BC doing some neat stuff, we heard the Yukon's up to something in this area as well. And a jurisdictional review maps that landscape. Who else is doing what across the country? There are toolkits, very practical sets of tools that can help you with a particular healthcare renewal challenge. There's guidance, so this is where there has been guidance that has come out specifically about how to tackle a particular issue, say a reform in the mental health care sector. There are reports that try to capture citizen or patient inputs systematically, so going out and speaking to samples of citizens or patients and trying to get their inputs into how the health system should be reformed or renewed. There are stakeholder position papers, say reports written by the Canadian Medical Association or the Canadian Nurses Association. Government strategic plans for the health sector, so many provinces and territories in Canada now periodically produce a strategic plan that sets out the vision for where the health system should be heading. And it can also include intergovernmental accords. And actually 25 document types in total, and I'll be able to show them to you shortly during the live demonstration. So lots of documents, policy-relevant documents, that helpfully complement the huge global literature that's already sitting in health systems evidence. The other way that we have coded all of the documents in the Evidence-Informed Healthcare Renewal portal is by priority area. So we looked at the priority areas that Canadian federal, provincial, territorial governments prioritized, and we coded all of the documents related to that. So if there is a new report from British Columbia that deals with how can we give a greater role to nurse practitioners in primary care, it would be coded as both primary care. So if you search on that priority area, it would pull it up. And it's also coded for health human resources. So if you clicked on that, it would pull it up as well. And in total, there are 16 different priority areas that are highlighted within the Evidence-Informed Healthcare Renewal portal. The portal is searchable in both English and French. And when you're doing an open search, so you'll see me shortly enter a term end of life, that then is connected to a powerful synonyms dictionary. So that if there's other terminology that people are using to get at the same issue, then we hopefully have captured it in our synonyms dictionary. So you don't need to worry about the fact that slightly different terms might be used across Canada to mean the same things. We've tried our best to come up with a set of synonyms, so by putting in one word, you're pulling up all related words. We also have an advanced search option, and I'll be showing you how that works, and that has the same fields as health systems evidence available to you, but you can also do searches by policy document type. I'll shortly be showing you how you would pull up only political party platforms as one example. You can search by priority area. I'll be showing you how you can pull up documents that are related to primary care renewal in British Columbia and timely access in Saskatchewan. And you can also just look by jurisdiction. If you just want to see what are the documents that are currently there from the Yukon, you could do that very efficiently. We also have a free customizable evidence service. So almost everyone that we encounter that uses the EIHR portal is sufficiently busy that it would be unrealistic to think that they would be able to check back periodically to see what's new. So if you're interested, however, in finding out what's been added to the EIHR portal, you can, when you register or at any point, go back after you've registered and change your profile and ask to receive the free monthly evidence service. And you can say, I'd like to see all the documents that you added in the last month, or only documents of particular types or in particular priority areas. So you will only get the types of material back that you have requested. We also have a list of additional resources available. So although the EIHR portal is focused primarily on documents, we also keep a running inventory of videos and podcasts that relate to healthcare renewal, and they have hyperlinks. So the moment you find an interesting video, for example, you can click on that and go immediately to the video. We also profile series for which only the most recent version can be found in health systems evidence. A classic example of this would be reports coming out of the Canadian Institute for Health Information that routinely produces annual reports. So they might have an annual report on statistics related to health human resources across Canada. So we put in the most recent version, so perhaps it's 2013 that we would have in there now, and you would be able to go back to 2012, 2011, 2010, and so on through the summary document that I'll be showing you shortly. And finally, in the summary document, this list of additional resources that I'll be showing you, we also profile other online databases. So there are other databases available across the country that helpfully complement the EIHR portal and health systems evidence more generally. An example would be there's a database about patient safety alerts that's maintained by the Canadian Patient Safety Institute, and that's available as a hyperlink. So if you're particularly interested in that, you can be reminded of the existence of that additional resource. So why use it? We think the portal can save you a lot of time by helping you rapidly identify documents on a given topic that have been prepared to inform healthcare renewal. So the documents are all in one place. Instead of you having to go and find them all, we're doing that work for you. We also tell you how recently the document was published, so as soon as you do a search, you can immediately see whether it was published in 2014 or some number of years ago. When they exist, we provide links to user-friendly summaries, but certainly to the full text report. And I don't think there's any exceptions in the EIHR portal. I think all of them have free full text reports. That's not necessarily the case with all of the content in health systems evidence, because it could be for a systematic review of effects that it's been published in a peer-reviewed journal that is sitting behind the paywall. So we provide access to a user-friendly summary of that review, to the scientific abstract, but we're unable in some circumstances like that one to provide access to full text. But for the EIHR portal, all of the content in it has links to full text reports. And the portal also contains these related documents that you can access very easily at any time. So other ways to learn about it, in addition to the webinar, I'll show you how to access these in a moment, but there's a 2-page backgrounder about the portal available from the site, which at any point you can download. It's also available in English and French. And there's also a video tutorial. So if you're participating in the webinar today and you think a colleague of yours might benefit from a 5-minute overview of the EIHR portal, you can point them towards the video tutorial. And that, again, like all of this, is available in both English and French. So contact details. If you have any questions or comments about the EIHR Roundtable, the best point person to contact would be Jennifer Campbell. If you have any questions or comments about the EIHR portal, or more importantly, if you want to submit documents to the portal, you can send an email to hse@mcmaster.ca. So if you were sitting in the Yukon Territory, for example, you do a search on Yukon, find that a number of recent government documents have somehow been missed in our constant effort to identify these documents, you could simply send us an email to hse@mcmaster.ca, include the documents, and they'll be added in the coming months. So very easy for us to address any gaps in the portal that you yourself identify. And if you're a Twitter user and would like to keep up to date on some of the news about new additions to the EIHR portal, you can follow us on either the English or French language Twitter feed that we maintain. So I'm now going to jump to a survey that I'm hoping all of you will fill in. So there are 4 questions, and I'll just go through them one at a time. You can vote as soon as you have a chance to read the question. The first one, top left corner, are you already registered on the Health Systems Evidence website? So registration is for free. Just takes about 1 minute, but my question is, are you already registered? Second question, bottom left corner, have you submitted documents to the EIHR portal by emailing them to hse@mcmaster.ca? Certainly fine if your answer is no, but if in future you're using the portal and find that we're missing documents, we would warmly welcome emails from you to bring those documents to our attention. Third question, in the top right-hand corner, have you signed up to receive a monthly evidence service containing new additions to the EIHR portal, as well as other health systems evidence content? So this, again, can be done either at the point of registration, or if you've already registered, you can go back at any point and change your profile and ask to be sent an update of new additions to the EIHR portal, either all of the ones that are added in a given month, or only particular document types, or in particular, or addressing particular priority areas. And then the final question, do you follow the EIHR portal on Twitter? So yes or no. So I'll just give you about a minute. It seems a lot of you have answered already, but I'll just give you a little bit more time and then we'll go on to the live demonstration. And while I'm doing that, Jen or any folks at CFHI, have any issues come up in the chat box that would be efficiently addressed now?
I'll just say, John, this is Jen, that folks have been asking if these materials will be available afterward, and what they'll get, actually, all registrants. We had over 100 people register, about 63 participants online now, but everyone's going to get the email with information. And there was a question that just came through as well with the Twitter handle, and I see Kimberly's helping us out here by including the Twitter handles in English and French to the EIHR portal. Robin's on Twitter as well. CIHR is on Twitter. CFHI is on Twitter. So lots of resources available there.
Super.
I guess the question, John, is how do people submit documents to the EIHR portal?
Yeah, so it's as simple as just sending an email to hse@mcmaster.ca, and you can either attach the document, or better yet, you could send us a hyperlink to the document and we would take it from there. So we have our own process for proactively identifying documents. Every month we have individuals who are actively seeking out these documents by going to a number of websites across the country and pulling in any new documents that have been added. And then we also have a referral mechanism that we operate with the EIHR Roundtable members. So they are invited every month to submit documents either that their own organization has produced or that they're aware of and feel should be added. So up until now, we've relied very much on EIHR Roundtable members and on our own proactive searching, but we've always been very open to feedback, and the odd time where someone says to me, gee, I went on the site and I was surprised that you didn't have X or Y, my message is always, please send them to us. So this resource will become ever stronger the more that people play an active role in sending us documents that they were frustrated if they didn't find them the first time. So we're very proud of how systematically we search and how EIHR Roundtable's members refer documents, but we also rely on folks across the country helping us to fill gaps when they see them.
Fantastic. So we'll profile in our follow-up email that contact to hse@mcmaster.ca is the contact that you provided in your slides.
Super.
And there is one question maybe just before we go over the poll responses here. Mm-hmm. Eddie asks, is it theoretically possible to access any citations within the documents held in the portal for analysis?
Yes. I guess if you mean, so if I understand the question correctly, we've even had some examples of that. So an example would be some colleagues of mine at the Harvard School of Public Health were interested in looking at the contents of, in this case, the broader health systems evidence portal. So we worked with them so that they were able to do analyses that looked at, for example, the types of studies that were included in systematic reviews. But we're very open to people taking advantage of this rich resource to conduct research using the data contained in health systems evidence. And again, you just need to write to us, hse@mcmaster.ca, and we'll be happy to get back to you about that.
Okay, fantastic. There was a question earlier, too, about whether it was a latecomer wondering if we had shown how to access the portal yet, but I mentioned we're going to do a live demo, so I'll pass it back over to you if you want to review these poll findings, and
sure.
We'll start the live demo.
Absolutely. Fantastic. Thanks, Jen. So first question, are you already registered on the Health Systems Evidence site? So roughly a 50-50 split, 30 of you yes, 26 of you no, and I hope that I should have put the response no, not yet, in the hope that you will register. Have you submitted documents to the EIHR portal by emailing them to hse@mcmaster.ca? So not surprisingly, vast majority have not, 51, but 4 of you have, so thank you very much to those of you who have sent in documents, but again, rest assured, through both the EIHR Roundtable members and our own proactive searches, we have lots of ways of finding these documents. Third, have you signed up to receive a monthly evidence service containing new additions to the EIHR portal, as well as other health systems evidence contents? And here, it's about 40%, what is 40% of you saying you have, 60% of you not. And then moving on to Twitter, amazingly, 15% of you yes, and 85% of you no. So that's fantastic. So just, some follow-up items for those of you who are interested. I would encourage you to think about registering and to sign up for the customizable evidence service so that you're aware constantly of the types of new things that are being added to the portal. So I think if I can, I'll go back now. We'll stop the survey. And then I think we can now go to the live demonstration. I think that was the end of my slides. So I'm just logging in. Whoops, spelled my fake email address incorrectly. And then just to remind people, up at the top, English is where I can switch the language to French. And if I want more about the portal, I can go to more about the portal. And if I haven't registered, I go to register. But now I've entered my email address and password because I've already registered. And I've clicked log in. So now it's just going to the open search page. So this is the open search page. So I could just enter a search term. I could click on Advanced Search, which I'll be doing in a second, or you'll see down below under Complementary Content, you'll see the IGO Portal box, but below that is Canada's Evidence-Informed Healthcare Renewal Portal. So I could click within that on why use it and who's behind it. That will give me, for example, a description of the EIHR Roundtable members, but also the contents of the portal. I could click on what's in it. I could click on the two-page backgrounder. So I mentioned that before in my slide deck. If you think this is a useful resource and want to share a brief outline about it with your colleagues, you could click on the two-page backgrounder and have access to that two-pager and then send it to a colleague. There's also additional resources to support healthcare renewal, and that's the document that I mentioned before that has 3 types of information on it. I'm just going to show it to you now. I'm going to click on it so that the document opens. I think that will happen in a second. And that includes the information about videos and podcasts. It includes the listing of any series that only the most recent version of the series are contained in the portal, and it includes the list of additional resources.
So one question that folks have was, and this came from Christina DeRose, she's wondering if there's a cost in signing up as an organization to the portal.
No, there's no cost to anybody, either individually or organizational. It's just free registration for everybody, so it's a public resource.
Great.
So the document that you have in front of you is the two-page backgrounder on health systems evidence. So that's what you get if you click on the two-page backgrounder. But I'm just going to go back because I was trying to click on the document below it, which I think I got that time. So hopefully that will open in a minute. That's the additional resources. And then if you'd like to see the video tutorial, you can just click on video tutorial. So if you have 5 minutes or you want to direct a colleague to a video that if they have 5 minutes, they could watch that video tutorial. I'm just going to try again to click on that PDF in the hopes that that will open. While that's trying to load, I'm just going to come back to the main page. So in the top left corner, if you're interested in any given month, the top 5 one-pagers about documents accessed by all users, you could click here. If you want to see what policymakers are reading, you can click here. If, however, I want to update my profile, so I'm now in the top right-hand corner, I'm going to click About Update My Profile, and I'm going to show you how you can sign up to receive the evidence service. So I just need to scroll down this page. So here is Canada's EIHR Portal. So I can open this up, and I can pick a national priority funding area, a performance indicator. So let's say I'm interested in only receiving EIHR portal updates in the area of primary health care. I could then go to primary health care and click that box, and then that is going to include any of those documents every month in an email that's sent to me.
John, and Susan has a question directly on this. She wants to know, is there a limit to the number of topics that you can select to receive updates on via the customized evidence service?
So not for the EIHR portal. So the EIHR portal, you can choose to receive the full listing of documents. So the easiest way to do that is to just click type of document, and it's defaulting to all here, and then you'll get all of them. every single document that's added every month. So for some reason the click isn't working for me on your screen, but if I were to click that box beside type of document, I would get every document that comes to that's added to the portal in a given month. The only restrictions are for the broader health systems evidence topics, systematic reviews, economic evaluations, where you have to pick a subset. And having picked a topic or all documents, I would then come down here and say, yes, I would like to receive a monthly evidence service containing links to newly identified documents. So that will give me access to the evidence service, and then I click update. So incredibly easy, free to just sign up to receive either all documents or documents in particular priority areas for the EIHR portal. So now let me go back to the search page. And at the risk of doing too many things at one time, let me see if this other document has opened yet. Yes. So this is the additional resources document. So on the first page, you can either click on videos and podcasts that address national priority areas to be taken to that part of the document, or you can click on series of documents for which only the most recent one is provided, or you can click on online searchable databases. I'm just going to move to the next page to show you how the videos and podcasts are organized. So there they are, English on the left, French on the right, organized by the publisher or producer of the videos and podcasts. So you'll see Health Council of Canada, when it was still functioning, was very much in the business of preparing videos and podcasts. So you'll see lots of information, and many of them available in French as well. Then if I were to go later in the document, I would see the series that are available, and I would also see the additional databases that we think might be helpful to you. So that's that document, but let me get back to the searches, and I'm going to quickly show you how I would do those searches that I referred to before. So I can just click directly on EIHR Portal down here, and what that's going to do is take me directly to that part of the advanced search interface, but I can also do searches from this general page. So let me just wait while that takes me to the right part of the search page. So here I am now in the advanced search page for the EIHR portal. So you'll see I have all of my priority areas showing up. I have all the jurisdictions, so if I only want to look for a particular topic area in a particular jurisdiction, I can combine them. And then you'll see here all the types of documents. So how about if I start with primary care renewal, and let's pick British Columbia. So I want to know about primary care renewal in British Columbia. I'm just waiting for it to switch from Alberta. So now I've ticked primary care renewal and British Columbia. So let me just click search. And you'll see, because I'm in the EIHR portal part of the bigger health systems evidence, this part has lit up. So I'm getting only the Canadian Healthcare Renewal documents lighting up. There are 15 of them that deal with primary care in British Columbia. So I've clicked on those Canadian Healthcare Renewal documents that met my search criteria. Should just take a second to get there. So you'll see now, going from left to right, the title of the document. So all of these are Canadian Healthcare Renewal documents. The year that, in this case, the document was published. So Caring for BC's Aging Population, Improving Healthcare for All. So that's if I recall correctly, a report from the BC Health Coalition, so a stakeholder in British Columbia, and it has a section that specifically deals with primary care renewal. You'll also see, and I believe this is from the BC Auditors Division, a review of oversight of physician services. And then you'll see a very large final report that was produced by a cross-national team that looked at primary care renewal as one of their areas of focus, and British Columbia was one of the studied jurisdictions. And then below that, setting priorities for the BC health system, which again has that's from the BC Ministry of Health, that has a partial focus on primary care renewal. Now, if I'm interested in the document, I can either click on the title, that will take me to a one-page summary of the document and then the link, or I can just click on Show Link, and that will allow me to move immediately to the full text report. So if I were to click on Full Text Report, I would get that report entitled Caring for BC's Aging Population. So that's a quick search for primary care renewal in BC. So now let me click on Start a New Search. And now I'm going to try and look for reports, policy-relevant documents about timely access. So I'm back on the Advanced Search page. I'm going to open up Evidence-Informed Healthcare Renewal Portal. So I'm just going to scroll down a little bit. So timely access. Timely access. There, I've got that ticked. And let's pick Saskatchewan, which is a little bit hidden down in the list. So I need to scroll down the jurisdiction list. There's Saskatchewan. On the one hand, it's astonishing that I can be sitting in Hamilton controlling a computer in Ottawa, and on the other hand, our expectations have risen so high about technology, I'm surprised it's not instantaneous.
So while we're loading to that next page on the timely access resources, there was a suggestion that Kimberly fielded from Louise Bergeron from the National Association of Federal Retirees. She was saying it'd be nice to have patient or citizen listed under role, since citizens are also contributing to the portal, and Kimberly wrote back to say that, it could say patient, caregiver, or citizen, so a good suggestion there from Louise.
Yeah, that's fantastic. Well done, Louise. We're at the forum here, we're increasingly very interested in citizen engagement, and yes, this was set up years ago where they got lumped in under stakeholders, but I think you're right that they should be singled out as a very unique and key role in the future of the system, so that's something we can program in going forward. Thank you.
And I'll ask this question that came in from Vicky. It said, what are the differences between the health systems evidence open search or the EIHR portal? When we search health systems evidence, does it search both databases?
Yeah, so anytime that you search in the open search in general and health systems evidence, it's searching everything, including the EIHR portal. So if I searched it from that home page, I would be getting absolutely everything. Because I'm here in the subsection of codes that only apply to the EIHR portal, only that part of it is lighting up. But I'm going to show you shortly how you can combine the two. For some reason, it wasn't registering my search, but there it is. So now I've got timely access and Saskatchewan. So if I click on that, we need to work on this title because this is the official title, but it's an Auditor General's report from Saskatchewan that deals in part with wait times. Then you'll see a report, Saskatchewan Surgical Initiative, wait times data for the period ending August 31st, 2013. Another report from the Saskatchewan Surgical Initiative. So all kinds of documents, Saskatchewan specific, that deal with timely access. So let me go back to start a new search. So let me just quickly show you how to pull up a political party platform. So we've had a number of elections recently across the country, and we know from a recent study where we looked at 30 examples of healthcare reform across the country, 6 different issues in each of 5 different provinces, that when the big reforms happen, it's almost always the case that they happen in the first 2 years after a new government was elected, a new political party, or a new leader was chosen for a political party. And often, though, that happens when big reforms happen, it's the combination of that political change with a fiscal crisis. So we know that political parties have big impacts, and their platforms have a big driving influence on what gets done once they're in government. So we have political party platforms introduced into the portal. I'm just trying to open up the portal part of the search so I can show you. You probably know that we just had an election in New Brunswick. So if I wanted to quickly see what the newly elected Liberals in New Brunswick said they were going to do for healthcare, I could come down to type of document and pick political party platform, and then I can click search. And there are 25 political party platforms loaded into the EIHR portal.
There we go.
So can you just click political party platform and hit enter? Yeah, so just click on the 25 results. Great. So there's the 2014 New Brunswick Liberal Party platform, and you can see that we also have from the last Ontario election the NDP platform and so on. We also have the PC Party of Nova Scotia platform. So very easy to go back and get a sense about what did the party that ended up getting elected, or the ones competing with them, what did they put forward in terms of major healthcare renewal. So if I just want to show you one last thing, because this has taken much more time because of the technology glitch. So let me just, I won't go through the full searches for end of life or leadership. I'm just going to show you where I would do it. And I just want to click on start a new search. I can combine any of the fields that are more generally for health systems evidence with a search of the portal. I'm just going to show you one example. I'm going to put in the open search field end of life. So if I open this open search, which is the same as the open search on the home page, the only difference it can be a little bit more nuanced. So the one on the open search is searching titles. So you'll see if I enter something in this first box, it is searching titles. But if I put it in the second box, then it's searching the title and abstract field. And then I hit enter. So now it's searching the entire database, which is why Canadian Healthcare Renewal Documents isn't lit up. It's showing all the documents. So on the topic of end of life, there's 1 evidence brief, 35 reviews of effects, 14 reviews addressing other questions, 46 economic evaluations, but 8 of them are Canadian Healthcare Renewal Documents. So if I click on that listing, the first thing that comes up is the Canadian Medical Association's report called End of Life Care, a National Dialogue. And then you'll see other examples of reports that have come out from across Canada about end of life care. So this was looking in the title or the abstract of the report for the term end of life. And you'll see with the synonyms what's happening is even though I entered end of life without hyphens, it has also pulled up end of life with hyphens. So it's a very efficient way to be searching the whole database, but here I could zero in on the EIHR portal. So in the interest of time, I think I should pull it or push it back to you on your side.
Thanks so much, John. And what we can do in our follow-up email to folks is link them directly to your site to be able to access that video. And thank you so much for being a total champion in handling this technology glitch with us. You handled it with complete poise. One last question, but we're getting a lot of thanks from people indicating what a rich information source this is, people who've already signed up to the portal during the call today, so that's great. Kay has a question she'd like to ask you. I think it'll be our last question before we close today's call.
Thanks, Jen. Just quickly, John, curious whether there's a way for people to register for the evidence updates without actually getting bombarded with email or e-junk.
Yeah, well, you know, if people sign up for it, the only people they will ever hear from is us. We would never share the list with anyone else, and they would only hear from us once a month with the email. It comes out in the last couple of days of each month. And it would only contain the content that they said they wanted. So they could choose to get only content on a particular topic, all content from the EIHR portal, or content from the EIHR portal coupled with content from health systems evidence. So the most you would ever hear from us is 12 times a year. It's only going to be in the areas that you asked to receive information in, and we would never share it with anyone else. So it's a maximum of 12 emails per year at the end of every month.
Excellent. Thank you so much. I think you guys have done a tremendous job at curating such rich evidence-based information that stays timely, and it's really put Canada, I think, on the map in terms of being able to have access to this rich information source that we can just keep building and building.
And it's funny, you know, because we always thought that the only people that would be interested in this, of course, would be Canadians, but we allow people around the world to be able to view this. So the system is sensitive enough that it knows if you're in Canada when you're accessing this, and you see it if you're in Canada. If you're not in Canada, you do not see it, but we give people the option of signing up to be able to view it. And I think we have something like 1,500 or 2,000 users around the world who are signed up to be able to access the Canadian content. So there's not just interest in Canada, there's interest in people around the world in learning from the Canadian healthcare renewal experience, so that's also pretty energizing.
That's exciting. Academy Health, we had a participant sign in from Academy Health on today's call who listened in. And absolutely energizing. And I just want to thank you and Robin. CIHR has done a tremendous job of creating this sort of diversity of information around evidence-informed healthcare renewal, and the portal, McMaster Health Forum, has done a tremendous job of creating this and keeping it relevant and making it accessible. Thank you to both of you, Robin and John, and also all the people who work behind the scenes today to make today's webinar possible, especially to our audience as well. You guys were great. We didn't lose any of you when we had that glitch there technically. We are going to, when we close the webinar, there will be a quick survey, which we will resend by email for those of you who have to quickly exit. And this does conclude today's orientation webinar on the EIHR portal. You see the website here, so please do access it if you haven't already. And we thank you again for participating, and we're looking forward to staying connected with all of you.